In today's episode of Your Body, Your Health, we'll talk about exercise, and specifically what exercise is the best for losing weight. Often people ask me, what is a good exercise equipment? And my most favorite is elliptical, but my second favorite is a stationary bike or cycling machine. This one is a stationary bike cycling machine that also can convert into an elliptical. What I like about this is that the chair has good back support, and it's important to have that, as well as the stationary bikes where your knee motion is in this motion as opposed to the ones that go like this. The ones that go like that is a little bit harder on the knees, but either of them are good. The important thing is to work out the leg muscles, which are the biggest muscles that we can work out, and so it burns the most calorie. And treadmill, again, does the same thing. Now with the treadmill, again, the problem is it can be hard on the knees sometimes. And so if somebody has already knee arthritis or knee problem, treadmill may not be the best exercise. I would say the best would be elliptical, because it's more gentle on the knee, good for the posture. And also when you're doing elliptical, you're working the arms too. So you're working upper body and the lower body. So one of my favorite exercise equipment is elliptical, and it's easier on the knee. It's good for overall posture, and it does do a kind of an overall body workout. So anything that works out the legs, which are the biggest muscles to exercise, will help burn more calories. So it's good for weight loss and for all of us that want to lose some weight, and it's good for fitness. So a stationary cycling bike as well as treadmills, they all have that. But the elliptical gives you the additional arms as well that you can work out at the same time. So you're doing the workout of the upper body as well as the lower body. And of course, it has incline and different resistance and stuff that you can gradually work into, as well as different programs. Now, we do exercise for different reasons. One of the reasons we do exercise is for general fitness. And in general, motion is lotion, and doing regular stretches and exercise, working out the whole body is good for all the joints, increases circulation, good for muscle tone. Then another reason to do exercise or workout is for cardiovascular health. So it's more of a aerobic exercises. With those, we try to bring up the heart rate to the level of, if you want to calculate the exact number, you take your age, you do 220 minus your age, and whatever that number is, you multiply it by about 70 to 80%. And that's the heart rate that you want to reach when you are doing aerobic exercise for cardiovascular benefit. So it reaches a point where you can still talk, but it's kind of a little bit of a labored breathing. So it's not to the point that you cannot talk at all because you're out of breath, but to about this level. So we take usually the moderate level of exercise where you are still able to speak, but a little bit labored breathing. So this is more for a cardiovascular component, and it's good for your heart because it makes your heart pump a bit faster and pump the circulation and helps overall your cardiovascular system. Good for blood pressure, etc. And then the other one that most often we plan to start a routine exercise, one of the most common New Year resolution reasons for doing exercise, is for weight loss. Now when it comes to weight loss, it's straightforward. It's calories. So roughly 3,000 to 3,500 calories is equivalent to 1 pound. So if you were to do everything else the same, but you add about 350 calories a day to your exercise regimen, so that when I do the elliptical, I look over here and I see that I lost 350 calories. If I do that 10 days, that would be 3,500 calories that I lost. If everything else stay the same, that means I will lose 1 pound during that 10 days. And of course, the same way works for diet as well, that if I was to eat less by 350 calories a day, everything else being equal, I will lose 1 pound after 10 days. So the important thing is, when it comes to weight loss, is how much calorie you are losing. So sometimes, some people may not have the equipment, or like me, they like to be more outdoors. I do a lot of cycling when I go outdoors in the summer times. But sometimes, even if you don't like running, jogging, or cycling, even walking, you are burning calories. So it still is good for weight loss. Now, you may have to walk a bit more than you would have jogged or ran, because walking obviously you burn less calorie than if you're running, but at the end of the day, every 3,500 calorie is same as 1 pound. Now, in the future videos, we'll talk about different diet programs and weight loss program. So one part of the equation is what we eat, how we eat, and the diet, which we'll have a whole video series on that. And one part of the equation is how much we are burning calories and fat and reducing the weight that way through physical activity. And of course, the combination of the two are important. Which brings me to the most important point. So, what is the best exercise for losing weight? That is a good question. When I look at YouTube, I see they have a 5-step approach, they have crunches, they have sit-ups, they have push-up, they have a special regimen and stuff that they say for weight loss. And a lot of those are well-meant videos from fitness trainers, etc. But as a medical doctor who has seen over 250 patient encounters, patient visits over the past 15 years, both from experience and from medical knowledge, I can tell you most important is consistency. So it's not specifically what exercise you do or a special regimen, but it's which exercise can you do on regular basis and to be consistent with it. That is what's more important. So to me, the best exercise is what you can stick to. For myself personally, I love cycling, and there's a lot of ravines around me, and I go every day at least for 2 hours. And if it rains, then I do my elliptical. In winter time, if it's not raining or snowing or an ice storm or something, I'm out there cycling. If I can't do that, then I'm here doing my elliptical or a stationary bike or etc. So the key is consistency. Now, most common thing that patients tell me when they start a program, after a while, they say, "Doc, I got bored." Or the most common is, "Oh, doctor, I'm so busy." Now, this is being told to a physician that they used to work 15 hours a day, seeing over 200 patients at times, working in urgent care, walking, family practice, and different clinics, a large volume, and is still finding the time to do that exercise. So we always have the time. The only thing is planning it and structuring it properly. So, for instance, for myself, in this equipment, I can actually put my iPad here, which is right in front of me. I can have the TV turned in front of me as well. So what I do is I come on the elliptical with the intention of doing 45 minutes to an hour. Sometimes that ends up being 2 hours. And why is that? I do not check my emails, I do not check my Facebook, and I do not check my YouTube unless I'm on the elliptical or stationary bike, and so I feel more productive. So I do some stock investment, I research my stocks over here, I read a lot of medical journals, I read them over here, I even sometimes review my patient reports and results and everything while I'm doing this. And actually that makes time go by so much faster, like you don't even realize it, and it's been an hour and I've been so busy doing work that I forget that I'm even on this elliptical. Sometimes my wife and I watch TV, some TV show or a movie, and I'm on an elliptical. And I'm enjoying that, my focus is on that, I forget that I'm actually on the elliptical. So the key is to do something or structure your exercise in a way that you don't get bored, that you can continue doing it, and you can do it consistently. So again, I have my iPad, I have my TV, some TV programs I tape on a PVR, and I watch it while I'm doing the elliptical. So again, for everybody it's different, but you have to come up with the structure. So that's how not to get bored and to stay on and to find the time, because everybody check their phone, everybody spend 20 minutes on checking emails, checking YouTube, checking Facebook. That 20 minutes, do it while you are on elliptical or a stationary bike. Some people spend time on the phone, talking to friends or family. You can do that while you're on elliptical or while you're walking. So be active. I hate talking on the phone unless I am walking in the ravine or I'm on elliptical, because I feel otherwise that my time being wasted. You become more efficient with your time. you get more done. And you know, the other good thing about exercise is it gives you more energy. When I start my days with some exercise, the whole day I have more energy and I'm more productive in life. So to conclude, what is the best exercise to lose weight? It depends on you. Doesn't matter the exercise machine, doesn't matter the regimen. What matters is what exercise you can make part of your lifestyle and stick to it and do it on a consistent basis. In the future videos, we'll talk more about different exercises. We'll talk about stretches for neck, back, shoulder, and both for people that have pain, for improvement of pain, and both for people that don't have pain, to maintaining fitness and to maintain resilience of the back and posture and the back and neck and everything, so that you don't get injured and you don't get pain in the future. There's an exercise we'll talk about that if you do it on consistently, you will never have knee problem. So these are some of the facts that we'll talk about. And again, exercise, aside from helping lose weight, it also, even without losing weight, helps your overall health. So your blood pressure can go down by 5 to 10 points. That's equivalent of one pill. If you do equivalent of 150 minutes per week exercise, that's 20 to 30 minutes most days of the week. And you can reduce one pill, even if you don't lose any weight. Your sugars, diabetes, your body, your muscles will take up more of the sugar, so reduce the need for diabetic medication, even if you don't lose weight. So again, exercise is such an important factor. Improves breathing for COPD and asthma. It improves overall health, digestive health. A lot of people come and tell me, doctor, I'm constipated all the time. What do? I tell them exercise. Go for a walk. And exercise helps the digestive system work better. So it's good for everything. Now, once again, in the future videos, we'll talk about more exercise and stretches, and we'll have a whole series dedicated to diet and proper eating and ways to lose weight. So I hope you enjoyed this episode of Your Body, Your Health. I would like to know what are the exercises that you find is best for you, and what kind of lifestyle modification you planning to incorporate your life to improve your health. Please leave comments in the comment section. If you haven't subscribed, please press the subscribe button, and you will be notified every time that I post a new video. I will be posting a new video every Friday, and if you like this video, please put like and do share it with your friends. Let's get the word out there. I'll see you in next episode of Your Body, Your Health.